Hi, I am MaryAnn Williams, and I am very honored to be here to tell my story in hopes that it might be a source of encouragement and helpfulness to other women that are going through this and their husbands. I came into the emergency room at Halifax Health 10 years ago. I was feeling most uncomfortable. I was sitting here in the hospital with my father, who was a patient. Planned to leave for Austria on Friday. My bags were packed. I was wanting to spend as much time with him as I possibly could before I left. I decided I cannot make that long plane ride the way I'm feeling, so I decided to go downstairs to the emergency room. As they did a sonogram and called in the GYN person on call, he came to me and he said, "You have ovarian cancer and you are not going anywhere." That was a shock to me, of course, as cancer always is when you get a diagnosis. So they admitted me and assured me that I was in good hands because they had a GYN oncologist here named Dr. Molpus, and he would see me and tell me what my course of treatment would be. My husband, he had Pick's disease and was in the final stages of that. And so the whole family was in Bedlam, and I was going to be the only one attending our son's wedding. Dr. Molpus was very kind, but very direct. He told me that trip was not going to be something I could make successfully. Dr. Molpus and the nurses were wonderful to me, and we were beyond comfortable. They did my surgery. I did wonderfully well.
I met MaryAnn about a decade ago now, about 10 years ago now, and I remember she was faced with some really difficult decision making. She presented with some symptoms and was found to have a fairly sizable mass that we knew was going to require surgery, but she was struggling with whether or not to stay in the hospital, move forward with care, or to try to make it to her son's wedding, which was coming up in the next week. And we just moved forward. We were able to make that decision and move forward with surgery and care thereafter. She's done remarkably well now, 10 years out from her ovarian cancer diagnosis, and still just feeling well, doing well, and no evidence of disease, and we're more than thrilled.
I was so grateful that I could come here to Halifax and see Dr. Molpus and have the care that I had. With my diagnosis and treatment and the physical situation I was in, the emotional situation I was in, there is no way I could have traveled to Jacksonville, Orlando, anywhere for treatment. I think I would have given up.
I think it's very important to have comprehensive care here at the Halifax Cancer Center of Hope, because it's so important to allow individuals who live in this community or near this community to be able to receive their care, their initial evaluation, their care and follow-up all close to home.
Well, I was very impressed with the attitude that my wife had about Halifax Hospital and the care and the love shown by the nurses and the doctor and everybody. I think that contributed to her well-being so much. When I look at MaryAnn, I see a person who is full of life. She doesn't mope around or say poor me or anything. I have to work to keep up with her. She's a very loving person and wanting to go places and do things, and it's like she's never been sick.
You never know what's around the next corner. So I want to say something about that, because those women need to know what you feel right now is not what you're always going to feel. You do not realize that around another corner of life, there is a whole other life.